Good afternoon, everyone. My name is Sanam Ashrafzadeh, and I'm honored to be presenting my Master of Public Health Practicum project with Vancouver Coastal Health. I know we're ending the near of the day, so just thank you for being here. And over the next 10 minutes, I'll be sharing my journey of redeveloping a housing-based substance use support strategy document in the midst of British Columbia's toxic drug crisis. Before we begin, I want to respectfully acknowledge that I live, study, and completed this practicum on the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. This acknowledgement is a reminder of the ongoing impacts of colonialism and are deeply tied to housing and substance use issues. As a part of my role, I also recognize that VCH's work takes place across the traditional territories of 14 First Nations. This reinforces our responsibility not just to acknowledge land, but to support Indigenous sovereignty, health, and self-determination in all public health efforts. I'd like to begin by setting the tone and recognize that I come to this work as a first-generation Canadian. I was born in Iran and raised in the UAE and have no experience prior to this practicum in harm reduction. That lack of experience definitely became a strength for me. It allowed me to approach the work with humility and a deep desire to learn and listen. I've also learned how much language plays a pivotal role in this field of work, which is why you'll see me using the term toxic drug poisoning instead of overdose. The latter often implies personal failure or moral weakness, but people aren't just using too much. They're being poisoned by an unregulated supply contaminated with fentanyl and xylazine. This shift in language reflects a shift in perspective from blame to systemic accountability. As well, I will be referring to people with lived or living experience as peers, as VCH does. As we're all aware, British Columbia declared a public health emergency in 2016. Since then, thousands of lives have been lost each year due to contaminated, unpredictable drug supplies, substances like fentanyl, benzodiazepines, and xylazine, which are often present in unpredictable combinations, making every use a potential poisoning. This also means that individuals are polysubstance users, but are not aware of it. This crisis doesn't exist in a vacuum, of course. It's compounded by social inequities, poverty, racism, and colonial legacies. Obviously, housing is deeply impacted. Nearly 75% of drug poisonings occur in private or non-private residences. This tells us that the places that people like you and I call home are also the places where they are dying, and that's unacceptable. First Nations communities represent only 3.4% of the population, but accounted for 17.8% of drug poisonings in 2023. The crisis in these communities is rooted in systemic issues: displacement, intergenerational trauma, child apprehension, and oversurveillance. These factors make stable housing and access to care incredibly difficult, and the system often criminalizes these realities instead of supporting them. In response to this urgent crisis, the Toxic Drug Response and Regional Addiction Program team, many of which are here today, at Vancouver Coastal Health, chose to develop a housing-based substance use support guide. This document is designed for housing providers across the region to use as a toolkit, something practical, accessible, and grounded in lived experience and evidence. I worked alongside a group of amazing clinicians, educators, and harm reduction experts. I reviewed current literature, previous feedback, and clinical expertise. The guide offers 5 strategic approaches that were previously determined by the team to improve safety and dignity in housing environments for people who use substances. The first strategy is creating population-specific, trauma-informed housing design. This means considering residents' physical abilities, cultural backgrounds, and substance use journeys. Features like natural lighting, access to outdoor spaces, and flexible layouts can enhance stability and dignity. We also explored innovative overdose detection technologies such as the Brave Button and Lifeguard Connect, which encourage residents to call for help during solitary use. Safer use rooms are designated spaces within housing sites where people can use substances with supplies and supervision. These rooms reduce fatal and non-fatal drug poisoning, foster trust, and improve resident and staff relationships. Staffing models may vary. Some sites may choose to use peer monitors, others may use self-directed protocols, but all prioritize safety. And the third strategy is ensuring harm reduction supplies are always available on site. This includes naloxone kits, both for personal and for staff use, as well as fentanyl test strips, safer injection and inhalation kits, and safer sex supplies. Supplies should be easy to access throughout the site and presented without judgment, something like a grab and go box in common areas. Training and education are essential, of course. Staff must feel confident in their ability to respond to overdoses, use trauma-informed approaches, and foster culturally safe environments. Research thus shows that regular training improves morale and leads to better care. Therefore, staff training recommendations were gathered and suggested in this document after consulting with different nurse educators on the team. Finally, we emphasized the role of staffing, especially involving peer workers. Peers build trust and reduce stigma. Supporting staff also means adopting collective care and trauma stewardship principles, where organizations look after those who are also doing the care work. As previously mentioned today, grief and loss is extremely prevalent in this work, and it is important to care for ourselves to help us continue supporting people. This practicum, I'll say, changed me. I arrived with academic knowledge and left with something far deeper, a sense of responsibility, humility, and a clearer understanding of how substance use is shaped by trauma, poverty, and structural violence. One of the most powerful moments came during a perinatal substance use training session. A peer shared her story of navigating addiction while motherhood and stigma. Her vulnerability broke down everything that I thought I knew about treatment and care. She taught me that healing begins with compassion and being seen. I've grown in my ability to ask difficult questions, to sit with discomfort, and to let stories and not numbers lead my understanding. I'm now more committed than ever to advocating for systemic change that centers empathy and justice. This journey was not without challenges, of course. The timeline was tight, as we all, I think, experienced, and it made it challenging to gather live feedback from residents and staff of housing agencies. I also had to face my own internalized biases, especially when first walking through the downtown east side with the team. But I was held by a team who encouraged questions, curiosity, and growth. Although I was not able to consult directly with residents during my practicum due to time constraints, this guide integrates prior feedback from VCH clients and staff who will go through further peer review before its final rollout. Looking ahead, I hope to see this guide evolve with community feedback as well. I'd love to support the creation of targeted versions for women identifying or lower barrier housing sites, as well as supplemental training materials. This guide is designed not just for practice, but also as a tool to support grant applications, program proposals, and advocacy, making the case for systemic change through evidence-based, resident-informed strategies. And most importantly, I will carry these lessons with me into my future work, continuing to listen, advocate, and show up for those who are most often unheard. Thank you so much for listening. I'm grateful for this opportunity to share my journey. A heartfelt thank you to the VCH team and to the communities who trust us to do better. Thank you to Dr. Mira for her continuous support throughout the practicum. And lastly, I want to thank the peer workers I met throughout this journey. Their courage, honesty, and strength are the heartbeat of this work. I'm so happy to answer questions. Thank you so much.